Town Hall. I'm Dan Hawkins from the Air Education and Training Command Public Affairs team, and today, as we deal with this invisible enemy called COVID-19, we're here today to address your concerns and what we're doing to take care of airmen and families and the JBSA community at large. And we have a lineup of topics today to talk to you about, including the JBSA operating status, base services, basic military training, technical training, and messages from our mission partners as well. Additionally, we will address teleworking and several other things with facilities. So a lot to talk about. With me tonight, we have Major General John DeGoes. He's the commander of the 59th Medical Wing. Brigadier General Laura Linderman. She's the installation commander for Joint Base San Antonio and also for the 502nd Air Base Wing. Major General Dennis LeMaster is the commanding general of the U.S. Army Center of Excellence, Medical Center of Excellence, to his side is Lieutenant Colonel Gary Moore. He's the deputy commander for the 737 Training Group at Basic Military Training for the Air Force, and the deputy director of staff is Brian Hoffman for the 502nd Air Base Wing, and he's going to talk to civilian personnel and teleworking later on tonight. And as we get started tonight, I'm going to cede the floor to General Linderman to kick things off, to give everyone an update on the base's operating status as we move to HPCon C over the weekend.
Well, thank you, Dan. And good evening, everyone, and welcome to our Facebook Live. I did want to provide an update on where we are in terms of the installation services and access. So earlier in the week, over the weekend, we transitioned from health protection condition Bravo to Charlie. And that's just another layer of protection on the installation to protect our workforce and our families, especially our training pipeline here at Fort Sam and Lackland and Randolph. So most recently, though, this morning, our team met this morning to discuss the mayor's stay home, work safe policy that went into effect yesterday at 1800. And in order to be better aligned with the city and to further encourage folks that don't need to be on the installation to stay at their homes and work from home, or to not come onto the installation for unofficial business, we are going to be opening JBSA tomorrow starting at noon for official business only. And what that means is JBSA active duty civil service employees as well as contractor employees are exempted from the stay-at-home work safe ordinance while performing official business. They are allowed to come onto Joint Base San Antonio as official business starting tomorrow at noon. Only military members, civilian employees, and other Department of Defense affiliated personnel, to include retirees, dependents, and contractors who are conducting official duties or business or have appointments at a medical or mission support facility, will be allowed on the installation. So all DoD and non-DoD affiliated personnel currently living on the installation will maintain access. Current visitor passes will continue to be honored, and future visitor pass requests will be assessed and approved by the unit commander or the designated representative. At the end of the day, if the function isn't vital, we have to minimize its footprint here on the installation to the fullest extent possible. Members reporting to work, if you feel something that needs to be addressed, if you fall into a category where you're not sure if you have access or not to the installation, please bring it to my attention or our chain of command or your unit chain of command, and we'll address it appropriately. We know there's going to be exceptions. We know not everyone's going to fall neatly into a category. We want to make sure that those who need access to the installation have access to the installation. In particular, AFES and DECA, meaning the commissary, so our PX and BX and commissaries are mission essential. They are still open. We're just trying to limit the foot traffic in there to official business and those that live on the installation. However, if you're a retiree and you're on the installation for a medical appointment or you have another personnel appointment here, you are free to access the commissary and AFES. So again, we're not denying people access to those facilities. We're just trying to limit the amount of people on the installation in order to protect, most importantly, our training pipeline. So with that, I'd like to turn it back to Dan for further questions.
And ma'am, I think it's important to note, as the release just went out, but the number of cases for positive testing for COVID-19 at JBSA is now 24, including one in our pipeline.
Yeah, so that just further reinforces that this is a threat. It's a threat inside the fence line and outside the fence line. And again, we're trying to preserve the mission essential functions here so that we can maintain our national defense. And one of our main jobs here is the training mission. There's many missions, and we can't name them all, and we can't necessarily determine here what's mission essential and what's not mission essential. That is up to the chain of command. So if you're considering or you're unsure of your status and where you should be tomorrow, please contact your chain of command, and they'll be able to tell you if you should be teleworking or if you should stay home based on the mission essential functions identified by your unit.
And General DeGoes, I wanted to ask you, because there's been a lot of questions on social media, but if beneficiaries do feel sick and feel like they should be tested, can you kind of talk to what is the process for that? Where can they go do that? I know we have some drive-through facilities both at the 59th Medical Wing and BAMC, so can you kind of talk to the overall health picture?
Sure. So first thing I would suggest is that they call the nurse advice line. It's for all of our beneficiaries. The first thing I would do is suggest that our patients call the nurse advice line to just get some advice. And if you're concerned, either through the interaction or you're just concerned, or you couldn't get through to the nurse advice line, or even our San Antonio Military Health System, we have a COVID hotline for questions. You could come into any of our MTFs. We have an MTF at Randolph that actually has a drive-through test capability at Randolph. Each facility has adopted new practices to try to keep our staff and our patients safe. So where we can do virtual care, either via telephone or via a video chat, we do that. But if you need to be evaluated because you're concerned about COVID for you or a loved one, you can come to any one of our MTFs. We do an initial screen of all of our patients before they come into the installation, and we segregate to make sure those who might have an infection get evaluated in a separate area than those who are just coming for a routine visit. We have drive-through testing capability Monday through Friday at Randolph, at the Randolph Clinic, at Brooke Army Medical Center, and at the Wilfred Hall Ambulatory Surgery Center, kind of, again, a drive-through. BAMC actually offers it on the weekends as well. So there's many different ways. We have robust testing capability at Brooke Army Medical Center. We have expanded the testing capability daily to where we're approaching now the ability to do 200 tests in a day. For tests beyond that capacity, we also have a contract lab that we use in town as well.
And Colonel Moore, I want to turn over to your side with the news that we do have a positive COVID-19 case in basic military training. Can you talk to how that occurred or where it occurred, and then some of the mitigation protocols that your team at the 37th Training Wing is doing to help alleviate some of those concerns from a lot of worried parents out there?
Yes, definitely. So this morning we did find out that we indeed had one individual positive for COVID. Individual came on 17 March in that crew, and we had started that week on the restriction of movement flight. What we were doing is making sure we could maximize social distance and keep trainees separate from other trainees and other military training instructors, as well as our civilian populace, to make sure that we could monitor them for the initial 14 days. Our dorm rooms, our bays where our individuals are kept at safe distances apart, so we can make sure that if there was to be a positive case, it would be less. So, for instance, a bay where a lot of our trainees would sleep typically fits about 60 folks. We reduced that number to less than 40 to make sure that if there was a case that would happen, our medical team can go in there and do the investigation and see how we can make sure that our people are safe. But our number one goal during this time is the safety and security of our trainees as they progress through military training.
Yeah, and I think it's important to note this is such a hard time. Secretary Esper yesterday had a Facebook town hall, and he talked about the Department of Defense's priorities as protecting people, maintaining mission readiness, and supporting the whole of government effort. And that's really, Colonel Moore, and really for anybody to address on the panel, but maintaining that balance of protecting airmen while still accomplishing the mission. It's a hard task, but it's something that we have to do as the military.
Absolutely, Dan. It's been a learning curve, and as this has evolved rapidly, very rapidly, we're learning as we go. And our medics are right by our side, informing us on what the best precautions are, what science is telling us. And as we've learned more, we're taking more and more precautions. And this is a natural step as we've done over at Lackland, and we're doing here at Fort Sam and all of our installations, is to take those social distancing pieces. We're limiting the class sizes. We're taking different approaches to how we feed our folks in our dining facilities, and making. I just drove here, and there was a line that stretched very long in front of the building, but everybody was at least 6 feet apart. And so things are different. It's a new normal for as long as we need it to be. But it's critical to preserve our people and our national defense.
And I want to loop in our joint partners here at JBSA. General LeMaster, I know the Army had their first positive COVID-19 case in the pipeline yesterday at Fort Jackson in South Carolina. Can you talk to some of the visitor policies for AITs here at Fort Sam Houston, as that has been a concern on social media as well?
Yeah, sure, Dan. So our policies are aligned with the joint base policies, and we've restricted family members from visiting their soldiers while they're conducting training here. In addition to that, we've canceled our graduations. We've canceled a lot of the on-post and off-post social interaction which would occur. Part and parcel to that is part of our efforts to protecting the force. We've limited any kind, physical training. We don't do any soldier-on-soldier PT events where they're touching each other. For example, holding the ankles of a soldier when they're doing their sit-ups. If there's any equipment that has to be used, we wipe down the equipment. What General Lenderman just mentioned is we're spreading out and maintaining the 6 foot distance between soldiers. But kind of looping back to your earlier question, Dan, about how do we maintain readiness and then the social distancing, it's kind of a sweet spot that we have to hit. We still have a readiness mission. We still have a defend the nation responsibility in our armed services, but some of the things by the nature of our service work requires us to come in contact with each other. So I run all the medical training and education for the Army, and just by nature of that training, soldiers are going to have to touch each other or come in close proximity to each other. Now, with the social distancing policies which have been implemented by the Air Base Wing, they were timely and they were important, was that the AIT, the Advanced Individual Training population, currently is a lower at-risk population than a soldier coming in from the outside community and entering the pipeline both at their MEPS processing station or basic training. Now, our mission continues here at the Medical Center of Excellence, and we still have soldiers coming through the pipeline. The Army may change that guidance, at the end of the day or tomorrow, but until then, we're going to continue to march because it all gets to readiness. One of the things that we're doing is developing a sterile transportation system when they're working contracts. And when I say we, I'm talking about Training and Doctrine Command, where they're going to be, soldiers will be in buses or perhaps aircraft, which are exclusively dedicated to their movement and filled at half capacity to make social distancing requirements. Does that get to what you're asking?
Yes, sir. And there's been also some questions, and I'll give you a chance to address them in terms of, is there any truth to training is going to be suspended and trainees are going to be sent home to assist in their states? You kind of addressed it, but I wanted to ask the question specifically because it came in on social media.
Right, and it's a great question. So training continues at this moment in time, and I think about your question in reference soldiers returning to the states, that would be applicable to your guardsmen and your reservists. So the policy is any guardsmen or reservists currently in training, when that training is over, they're going to be sent back home because we know their states need them.
And I want to pivot too, and we're going to talk more about trainees, both soldiers, airmen, and we also have other service branches here as well. But I also wanted to take time to address our staffs, our instructor cadre, other staff that supports the training mission. There's a lot of concern from families who have loved ones who are out there on the front lines doing the training that needs to be done to maintain our mission readiness, and potentially exposing their family members who might have issues of their own to more exposure to the virus. So what are some of the things, and I'll point towards General LeMaster and Colonel Moore, that you guys are doing from a staff perspective to protect airmen, soldiers, and their families?
So I'll start. We can't perform our training mission with our military training instructors, our military training leaders, as well as the civilian support that we have. So the 502nd Air Base Wing was able to go and secure many rooms on base. So for our MTIs that would MTLs that would like to work on base and to be in that environment and not proceed off base and come on base and still take care of the mission that has been offered to them, and many of them are taking that aid. So we really do appreciate that, General.
So what I would tell you is social distancing is our national responsibility as citizens. And you bring up a great point about those individuals transiting on and off base. I mentioned a moment ago that our AIT students are at a lower risk because they're trapped. They can't go, and we can't bring family members or friends on. However, what I would tell you, and I've told my staff this, is that when they go home, if they live off base, there's a national expectation that they will do the right thing and go from base to their quarters or to their home and maintain social distancing. We're not eliminating the risk, we're mitigating the risk. I put roughly half of my staff, so 5,000 or so folks assigned to the Medical Center of Excellence. Just about most of the civilians are on a telework policy, and thank you so much for opening up the bandwidth across the community that our folks can telework in from their offices. It's absolutely critical that we do this. Those soldiers and those civilian staff which have high-risk family members, say spouse that may be pregnant or is immunocompromised, we're having them telework in from their homes. We're not bringing them into work because we're concerned about their families and we're concerned about them, and we realize that there is an element of risk when folks travel back and forth from off-post domicile to work.
And the senior enlisted advisor to the chairman of the Joint Chiefs of Staff on yesterday's SecDef town hall kind of talked to that and talked about, it's really prudent for leadership to really be active and aggressively working that. And again, if you have a concern, you should raise it to your chain of command.
I've got some of my best feedback from soldiers who are reaching out, and we're a military organization. And I think, as both General Linderman and General DeGoes would back me up on this, information doesn't always make it down to the lowest level. So for those of you that are watching, need your questions. And if you feel like the chain of command isn't as responsible as it could be, you can find me on Outlook, or you can reach out and ask a question on our Facebook Live sessions, because there's been some great ideas which have come up from family members and also lower-ranking soldiers, which have their voice is just as important as anyone else's.
And that's been a big concern, is the social distancing aspect. And Colonel Moore, I kind of wanted to give you the opportunity to talk to some of the things that BMT is doing in terms of that, by reducing the number of airmen who are housed together and some of the other restriction of movement activities when it comes to social distancing to help in that arena.
Yeah, just like the General said, social distancing is our number one way to help mitigate the spread of this virus. So in basic military training, we are looking at modifying some of our curriculum to make sure that, bottom line, your trainee at home, your loved one, is safe and secure in our environments when we are responsible for their care and feeding. So social distancing is number one, continued hand washing, more sanitation. We've had a lot of help from the civil engineers and the contractors and the 502nd providing more services for us. We've been able to extend hours in the DFACs, so our trainees aren't rushed through there, and they can make sure they're taking their time and as sanitary as possible.
And at this time, I want to bring in Lieutenant Colonel Andy Cullen. He's the deputy for the 502nd Civil Engineering Group. And to be fair, I left him off the intro list, so I apologize up front. But in terms of cleaning facilities where there's been positive COVID-19 cases, can you talk to some of the things that are being done to make sure that our facilities are safe for us to continue to be able to use?
Sure, that's a great question, and I know a lot of facility managers, a lot of mission partners are concerned with these questions as they come up. Our goal is to try and get these facilities turned back over as quickly as possible so we can be as least minimal impacting as it already is. The Air Base Wing has recently established some new contracts to be able to do this quick, deep clean service. Right now, the current CDC guidelines say that we have to go in and clean in areas where the member has been active for 30 minutes or more. Our current base posture is we're looking at areas where the member has been active for 15 minutes or more. So we are very concerned on trying to be as active as we can in that. For the contract itself, it is going in and it is cleaning in areas where there are high touch areas. So it's countertops, it's desktops, doorknobs, keyboards, and bathrooms if that's what's been identified by the facility manager. They're using products that the CDC and EPA has approved specifically for viral type cleaning. And they follow the procedures the CDC has set up to include, they clean the surfaces first, they spray it with the disinfectant. They let the disinfectant sit on that surface for a bit, and then they wipe it up, and then they clean up all the waste and stuff afterwards, and that's disposed of properly.
And we also had a question on social media, more than one. Are there preventative health measures in place for the actual workers who are doing the cleaning, and also even just some of the standard janitorial or custodial type of contracts?
Yes, and these workers, they're well versed and experienced in performing tasks that involve sanitation, and they already have proper PPE that's written to their contract that they have to adhere by. We have increased social distancing as we've gone into these areas, and we've also tried to mitigate on what areas we are going into. It's kind of a double-edged sword because people want to continue to have these cleaning contracts happen, but at the same time, we know that anytime you bring new people into an environment, there's that risk. But we're taking every step possible to make sure that they're following the proper guidelines for the CDC to do these cleaning actions.
So I want to transition now to teleworking, General Linderman, and I know guidance is out. You know, we're talking more about mission essential activities vice mission essential people, because when we initially planned for that, that's not necessarily how we thought about it. And COVID-19 has really forced us to kind of reevaluate how we look at some of the planning mechanisms that we've had in place. But can you kind of talk to teleworking and what the plan is for that? And maybe Mr. Hoffman can jump in as well.
Sure. So I think all of us are aware of the initiatives to more telework, but more telework means you need more bandwidth. And so, General Master, you were so generous in giving us the credit for increasing the bandwidth at Fort Sam, but it was the Army that did that. So, good on the Army. It was the signal brigade here at Fort Sam that's been working overtime, and they're phenomenal. And just as on the Air Force side, though, the Air Force network over at Lackland and Randolph, our Air Force communicators are working overtime to expand the bandwidth as quickly as possible and as efficiently as possible. We're never going to have enough. But we're working as fast as we can to expand that capability. That being said, it's critical that commanders do prioritize who absolutely needs to be teleworking, who needs to be doing those mission essential functions and mission essential tasks. There's routine tasks and urgent tasks and mission essential tasks, and we're counting on the commanders and supervisors to help the unit prioritize so that we make sure we're using that bandwidth in the most efficient and effective manner so it's mission accomplishment. I want to make sure that all your questions are answered because there are quite a few related to telework and who's in the telework status. Dan kind of alluded to it. This is not your typical emergency. I don't think any emergency ever is, but it's an opportunity for us to better define what we need here in a pandemic is different than what you need during a snow day or what you might need during another type of emergency here San Antonio. So this pandemic is going to require more presence for the medical folks on the installation, more emergency responders, more people working the communications piece to make sure that bandwidth is open, whereas they might be able to take a day off during a snow day. So that's critical that we rethink that model of what mission essential is. And really the commanders have all the authority to decide that. Including your civilian workforce. If they're not identified as mission essential currently in their contract or in their PD, that's okay. You can verbally make them mission essential for this particular response. And so with that, I'd like to turn over to our Deputy Director of Staff, who can speak a little bit more about teleworking and the requirements and guidelines.
Yeah, thank you, ma'am. Well said. It's an ever-changing situation we have here. It's very unique. As you said, there's some mission essential and position descriptions, right? Those PDs for civilians, but there's no coronavirus in the PDs. So as commanders are trying to deal with this unique situation, we're just trying to open up the aperture, get them as much flexibility and as many tools as possible to use. And teleworking is one of those. So we put a lot of smart guidance out there for commanders to take advantage of teleworking. At the 502nd, we've identified those key mission functions and then those tasks underneath it. And then commanders are empowered to point to the critical personnel, whether military or civilian, to say, hey, I need you to take care of this task and this mission and help me through this coronavirus, right? And help me navigate through this.
And so what would you tell potential employees, regardless where they work, if they are unsure about if they're mission essential or not? Because there's a lot of questions on that.
Yep, that's a great question, Dan. So first and foremost, over communicate. So communication is going to be key in this emergency. And you're probably going to hear it a lot throughout the rest of this panel, right, with these questions. Start with your chain of command. So your direct supervisor, that's definitely the first person to start with. General Linderman also empowers employees to jump ahead if they're not getting that response from their direct supervisor, right, and utilize the whole chain of command if need be. So they're going to give you guidance on how to start teleworking, the paperwork and the process for that. They're going to help you out with setting up that time management, that schedule of communication, and the prioritization of your tasks to make sure you're still focused on the key mission functions and the most important priorities for JBSA.
Yeah, and there's also a little bit of debate about how alternate duty locations work. Is that something that you can talk to as well, Brian?
Sure. So commanders have the authority to designate an alternate duty location. In some instances, that's the residence. So a frequent question we get is, can civilians be, quote, forced to telework? And the answer is yes. In emergencies, a commander can direct someone to telework if they've given them the residence is that designated alternate place of duty.
Yeah, and I just think it's important to note, again, and we talked about it with General LeMaster, but you really just need to work with your chain of command on every scenario. They truly are your best source of information. So we have a question, and I'm going to pose it here to General Linderman. We're getting a lot of questions on social media about rumors of a positive COVID-19 case at the Child Development Center. Can you speak to that, ma'am?
Yes. So there has been no positive case of a child at our development center, or a staff member for that matter. So there was a staff member that was potentially symptomatic, but they performed the proper procedures and removed that person from the facility, did accomplish the test, and the test came back negative. So I can report that there are no positive cases in any of our child care development centers or youth programs, for that matter. But so we do want to thank our staff. They are incredibly committed and dedicated Americans who are taking care of our children. And we know that our child care development centers are mission essential, and our staff are mission essential. And we'll never be able to thank them enough, but I'd like to start by now just recognizing the fact that they are on the front lines, just right beside us, helping accomplish this important mission, and providing the safety and security for our kids while their parents are at work. So that said, we have changed our child care development guidelines. And we talked about how what the emerging nature of who's mission essential. And if you or your family members are now considered mission essential by your chain of command and you need childcare and you previously weren't in any of our child care development centers, you're free to come to our centers. They have capacity. They have capacity to support you. And if that's one less thing that you have to worry about, we'd love to be able to support you in that.
Another question we have, and this might be in General LeMaster and Colonel Moore's lane, but there's a few questions about how is it working for service members who might not be able to leave here after graduation. And I know with the domestic travel order that came out about a week and a half or so ago, caused a lot of questions when it comes to people who are in a training status and they graduate, can they go home? So could you talk to it, General LeMaster, from the Army side, and maybe Colonel Moore on how graduation, or what after graduation looks like?
Sure, Dan. It's an important question. So the Army's issued a stop movement order with some caveats to it. And generally speaking, when soldiers graduate from a class, with the exception of our guardsmen and our reservists, they're going to be here for a while until the policy or adjustments are made. This includes permanent change of station, PCS moves, and whatnot. I think this is going to shake out at some point when Department of Defense leadership, in coordination with our national authorities, feel where it's at a safe time to allow soldiers to go for onward movement.
Colonel Moore?
So yeah, we must continue to balance our great air and space force and feed our pipeline with also balancing the safety and security of our folks. So currently we are still sending our graduated basic military training airmen to technical training. Our 2nd Air Force commander has taken some steps to change some of the transportation modes, utilizing C-17 aircraft and other contracted charter to make sure that our trainees are going directly to our technical training locations and being ready to fill in the ranks of the needed and critical skills that we have in our Air Force.
I got to jump in because I think there's a critical distinction here between what the Army's doing and what the Air Force is doing, because we're kind of doing the same thing, but we're two different parts in a pipeline, right? So your initial entry training, to use Army parlance, so basic trainees are coming in for their initial entry training. I'm advanced in individual training, so the soldiers, we're step 2 in the pipeline. The soldiers have already come in and gone to basic training, and they are still coming to their medical training if they're going to be in a medical military occupation specialty or area of concentration. So we're saying the same thing, but a little bit differently. I just want to make sure that our audience understands that.
Yeah, there's a distinct difference. Basic military training, brand new civilians that we make level 1, brand new airmen, and the general takes basically that next step and makes them their career specific experts.
Yeah, well said.
Thank you. And General LeMaster, this question is for you, but there was a question about how come trainees coming from BCT, from basic combat training, to the AIT training aren't actually tested on arrival. There was some debate on social media saying that the screening process isn't enough, and that some trainees may not be truthful because they want to continue on in the training pipeline and not be washed back.
Yeah. So that's not entirely factual, and I'll just kind of open my remarks up with I generally believe that our trainees are truthful. There may be 1 or 2 untruthful, but that always sorts out in the end anyway. So a couple things that we are doing. If we get new trainees coming in, whether they're officers, non-commissioned officers, or enlisted soldiers, and they're not feeling well, we screen them. And out of abundance of caution, when we have soldiers come in from, say, Germany or Italy or one of our high-risk states where we have very high degrees of transmission, say New York, Washington State, Louisiana, they immediately go into a 14-day isolation so until we watch to see whether they yield symptoms or not, and then they begin their training. But we are training, we are screening if they fail ill, but it's got to be clinically indicated. And the bar is very low to get screened, to get tested for those folks coming in.
Thank you, sir. Turning to General DeGoes, talking about staff, and we talked about it earlier, but our first responders, our medical teams, they're really going above and beyond, working long hours, seeing a lot more patients than potentially they're used to seeing. And some of the questions have been, how are we taking care of our medical professionals?
Right. So we make sure that we don't put anybody into a job that they're not trained for. So we've done enhanced training and retraining for how to use the proper personnel protective equipment, or PPE. The right masks, gowns, gloves, and the ability to use those is how to deliver health care safely. And so we actually have a disinterested observer who watches our staff don or putting on the PPE to make sure they do that right. And we also have them watch when you take it off, because it's known through research, some with Ebola, some with other highly infectious diseases, that when you put on your PPE, putting it on right is really important. But perhaps the most important way of preventing infecting yourself when you're taking care of COVID positive patients is taking it off appropriately. And so CDC guidance, which we follow, also suggests that you put a lot of attention on training, and both in putting it on right and in taking it off right. So we focus on that quite a bit.
Yeah, and as a reminder, I really, and I'm going to read it off the piece of paper because I just don't know it by heart, but I really wanted to make sure this information gets out. The BAMC medical professionals are really standing by to answer your concerns and questions with the hotline number. It's area code 210-581-2266, and that's option 6. And they're there between the hours of 0700 to 7 p.m. Monday through Friday, and on the weekends 10 a.m. to 4 p.m. And I think it's really important to utilize these resources. If you have questions, don't be kind of sitting out there wondering if the internet is right.
Yeah, Dan, that's a great point, because we're trying to increase connectedness for a lot of reasons in the military. Stress and resiliency, improving that, and social distancing to reduce infection sometimes puts a person in somewhat feeling isolated. And so there are many avenues to get information via the telephone. So we got feedback several weeks ago that the nurse advice line, which is managed by the Defense Health Agency, was getting overwhelmed with a 200% increase in phone calls. And so the DHA actually kind of put in an emergency contract out to increase access. But to the credit of the San Antonio Military Health System and Brooke Army Medical Center, we actually added our own hotline, which Dan just read you the number, to give you other avenues to ask questions and stay connected with good information. Thanks, Dan.
Yeah, and I also want to give out the number for the San Antonio Metropolitan Health District. General Linderman and the JBSA team works really in lockstep with Mayor Nurnberg and the entire San Antonio community, but they have a COVID-19 hotline for residents as well, and that is available in both English and Spanish. Residents can call 210-207-5779 Monday through Friday, 8 a.m. to 5 p.m., and on the weekend, Saturday and Sunday, 10 a.m. to 3 p.m. And, General DeGoes, I kind of want to give you the opportunity to reiterate, what people should do if they are feeling symptoms. Where can they go for help?
Right. So again, the nurse advice line, our COVID hotline that Dan just mentioned, you could go to the Randolph Clinic, to BAMC, to Wilford Hall. For our trainees, there's a trainee health clinic on Fort Sam. There's also trainee health at Lackland. And so, we have options for everybody, either in person or via telephone information. And one of the things that we've done with a lot of our providers is we've given them the ability to work from home, telework for our providers. And we have many providers using forms of video chat to do patient visits virtually And our access to care actually now is better today than it was 2 months ago before we were dealing with COVID, because we've expanded this new virtual access. So there's many different ways other than driving in and potentially bumping into somebody who might actually not know that they have COVID yet. So take advantage of one of those, please.
And one of the other questions we got, General LeMaster, is about grooming standards and what those are right now for Army soldiers.
So we haven't gone to a COVID haircut. I just talked with General Linderman before we started, and the barbershops are still going to be open. We're going to observe the appropriate social distancing standards, but I need a haircut pretty soon, and so do all our trainees. And until we get guidance that we're going to adjust the grooming policy, we're still going to execute the current policy.
Okay, and I want to roll over to Brian. I know he's got something else that he wants to throw in here.
Thank you, Dan. So we talked about civilians concerning teleworking, and I just want to make sure that we know there's other options out there, right, that we're leaving open for commanders. Teleworking is a fantastic way to balance that safety of the workforce against mission needs. But if that personnel, by the nature of their work or their importance or their criticality, needs to come into the office in order to perform the job, well, commanders have that flexibility. They have the ability to reach out and point to that civilian and say, you're critical enough, I need you to come into work. And then use good health practices, good social distancing practices once they get in. And on the flip side, sometimes due to the nature of the work, they're not able to telework and they're not able to come into the office. Perhaps their face-to-face class was canceled, or they're teaching in close proximity all the time. And so commanders have an option to go to admin leave for those civilians as well. So really want to stress there's lots of options for you to take advantage of your civilian workforce, to really use them to get at the mission and still balance the health and needs and well-being of your workforce too.
Thanks, Brian. And Colonel Moore, we had a question come in about upcoming BMT classes being canceled. As of now, the pipeline's still open.
The pipeline's still open. We are continuing to graduate airmen, and in fact, tomorrow, if you go online through our BMT, our 37th Training Wing website, you'll get to see a brand new class of graduated airmen. Unfortunately, we can't have the family and friends see their loved ones cross the line and raise their hand and say the Airman's Creed, but you'll be able to see them online, so please join us there.
Yeah, and those graduations typically start at 9 a.m. Central Time, so on the USAF Basic Military Training page, so you can see everybody graduate. And Colonel Moore, I wanted to bring up a point. I saw it in my notes, and we didn't really talk about it, but I know there was a little bit of concern that there was a positive case in BMT, but the mitigation protocols that have been put in place for restriction of movement actually helped confine this to a very small place, kind of illustrating like at least what we have initially planned for, it is working and we have a good plan moving forward.
Most definitely. We got incredible guidance from our medical mission partners on the best ways to mitigate and the restriction of movement, making sure we're keeping those safe distances safe and secure. And we are modifying some of our curriculum, but by doing that, we lessened the amount of contact that individual may have had. And now the medical team are going back and doing assessments and making sure that anybody else has been, might not have been possibly in contact with that individual.
And
Dan, I can jump in here. So the trainee was about their 7th day of training. They were part of a class 653 that came in about the 17th of March, last Tuesday, a week ago. All of them were screened on arrival with a standard screener that they had also before they left their military entrance processing center, or MEPCOM. That same screen is done by Army, Navy, so there's a multiple layer of defense to keep our trainees, the mission, and the community in which we live and work in safe. It begins at MEPS before they ship to an Army training, basic training, or in our case, Air Force basic training. That same questionnaire is repeated on arrival, and one of the 653 had been on a cruise in the few days prior, and so because of that, that person went into a 14-day quarantine. That then the restriction of movement in an isolated training center that has its own dining facility, has its own PT pad that is not in contact with any of the other basic trainees, and they have regular monitoring. And this particular person who was positive presented to the clinic and was evaluated. A test was sent. From the time that there was concern that they were ill, they were then segregated into a different, did not go back to their training element, were kept in a separate area away from others as a person under investigation, is what us medics call it, until the test either comes back negative or it comes back positive. In the case of the positive, at that point, then we put them in an entirely separate dorm. And then, as my colleague mentioned, anybody that they came into contact with in the days prior to the diagnosis or the test coming back positive is also now going to start a 14-day quarantine away from their training site. So multiple layers of defense to protect the other trainees and to protect the Joint Base San Antonio and to protect the community that we live in and to protect the staff as well.
Thank you. And as we get close to wrapping things up, General LeMaster, I wanted to give you a last opportunity if you had anything else that you really feel like we should add here.
Well, what I would like to add is my thanks. General Letterman, you've done a great job in managing the Joint Base across 3 different installations, very complex work. And then General DeGoes, you've done a great job managing the medical response and the medical effort to take care of our service members, whether they're Air Force, Army, Navy, or Marines. Thanks to both of you.
Ma'am?
Oh, thank you, Dan. And I just want to thank our panel members, but most importantly, thanks to everyone that's tuning in to this live broadcast. And we're extremely grateful for the questions. We're going to continue. The ones that we weren't able to answer tonight, we'll make sure that we attack those as we go forward. But I do want to thank my mission partners here at the table, sir, and my team, the 502nd, and of course, all of you family members out there that are supporting us and your loved ones here. You know, your families and your loved ones are the reason why we're here, to protect them and keep them safe and also allow them to enter into our service to defend our nation. So with that, I also want to thank the city of San Antonio and the region. They've been phenomenal partners, really keeping us closely tied into their efforts and to what they're learning as they go forward and best practices are being shared. So with that, I caution or I encourage everyone, General DeGoes mentioned it, but we don't want to be too isolated or so isolated during this time of crisis that we forget, that connection is critically important at this time. So we're working with our first sergeants, we're working with our religious teams here, our chapel teams, to make sure that we're finding creative ways to make sure that throughout this crisis we end up stronger than we started. And it's going to be a creative way, it's going to look a little different, but we're committed to making sure that this family stays strong.
And I would also encourage you to find more information. You can go to www.jbsa.mil. There's coronavirus information there and what the base is doing, operating hours, things of that nature, as well as on the JBSA social media platforms as well. And really thank you to all of our panel members. And for the entire JBSA team, we'll say so long and good night.